Flonase spray is used to relieve seasonal and year-round allergic and non-allergic nasal symptoms, such as stuffy, runny nose, itching, and sneezing. It can also help relieve allergy eye symptoms, such as itchy, watery eyes. This medication belongs to a class of drugs known as corticosteroids. It works in your nose to block the effects of substances that cause allergies, such as pollen, pet dander, dust mites, mold, and to reduce swelling. Indications. Flonase Nasal Spray is indicated for the management of the nasal symptoms of perennial non-allergic rhinitis in adults and pediatric patients aged 4 years and older. Dosage and administration. Administer Flonase Nasal Spray by the intranasal route only. Prime Flonase Nasal Spray before using for the first time or after a period of non-use, 1 week or more, by shaking the contents well and releasing 6 sprays into the air away from the face. Shake Flonase Nasal Spray gently before each use. Patients should use spray at regular intervals, since its effectiveness depends on its regular use. Maximum effect may take several days, and individual patients will experience a variable time to onset and different degree of symptoms relief. Adults. The recommended starting dose in adults is 2 sprays in each nostril once daily. The same total daily dose, 1 spray in each nostril administered twice daily, HAM and HPM, is also effective. After the first few days, patients may be able to reduce their dose to 1 spray in each nostril once daily for maintenance therapy. Maximum total daily doses should not exceed 2 sprays in each nostril. There is no evidence that exceeding the recommended dose is more effective. Adolescents and children, aged 4 years and older. The recommended starting dose in adolescents and children aged 4 years and older is 1 spray in each nostril once daily. Total daily dose 100 micrograms. Patients not adequately responding to 1 spray in each nostril may use 2 spray in each nostril once daily. Total daily dose 200 micrograms. Once adequate control is achieved, the dosage should be decreased to 1 spray in each nostril once daily. The maximum total daily dosage should not exceed 2 sprays in each nostril, 200 micrograms per day. There is no evidence that exceeding the recommended dose is more effective. Contraindications. Flonase fluticasone propionate nasal spray is contraindicated in patients with a hypersensitivity to any of its ingredients. Precautions. Before using fluticasone, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Side effects. Nasal dryness, irritation, nausea or vomiting may occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. If your doctor has directed you to use this medication, remember that your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. A very serious allergic reaction to these drugs is rare. However, get the medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, especially of the face, tongue, throat, severe dizziness, trouble breathing,